السلام عليكم. اليوم راح نحكي عن ال parasitic infection بالGUT الجينيتي Acute tract. Most common example schistosomiasis. The urinary schistosomiasis is caused by the trematode or flake called schistosomia hematobium. We know there is three types of the schistosomia. The specific one for the GUT is the schistosomia hematobium. It's occurs in Africa, Egypt, and the Middle East. Freshwater snail release the infective form of the parasite, Cercaria, which can penetrate the skin and migrate to the liver as schistosomiasis. Where they mature, adult flakes couple migrate to the vesical veins and lay eggs containing miracidial larvae, which leave the body by penetrating the bladder and entering the urine. The disease has two stages, active and inactive. The active one, when the adult form are actively laying eggs, and inactive when the adult has died and there is reaction to the remaining eggs. This is the cycle of the schistosomia life. We can see it in details here. It's the snail. Okay. The presentation. The first clinical sign is the swimmer itch and the local inflammatory response. Other early manifestations include Takayama fever, generalized allergic reaction, which includes fever, urticaria, lymphadenopathy, hepatosplenomegaly, and eosinophilia. Active inflammation results in the hematuria frequency and terminal dysuria. And the investigation is midday urine specimen, because the eggs will be laid commonly from the 10 a.m. to the 2 p.m. So we should take the sample in this period to be high chance to find the eggs. Second one, the bladder and the rectal biopsies may contain eggs, distinguished by the having terminal spine. Serology test like the ELISA and cystoscopy may show fresh conglomerate tubercles, old classified yellowish tubercles, eggs in the trigone, sandy patch, and the lusterless ground glass mucosa that's like the normal vascular pattern. Other obvious lesions include bilharzia polyps, chronic ulcer on the dome that's bleed when the bladder is deflated, weeping ulcer, vesical stones, malignant lesion, stenosis or patulous ureteric orifice, all are signs of the schistosomial infestation. IVU may show the calcified, contracted bladder and obstructive uropathy. Ultrasound demonstrates the hydronephrosis and the thickened bladder wall. You can see here the calcified wall of the bladder. Here we can see the polyps or the calcified material inside the bladder. The treatment is a common medication is the praziquantel. The dose is 40 mg per kg, divided in 2 doses, 6 hourly apart. Metformin and oxaminoquine are the drugs of choice in treating schistosomiasis. Complication: the chronic infection can lead to the obstructive uropathy. Ureteric stenosis is treated by the ureterocystectomy. The bladder contract is treated by the enterocystoplasty, and the ulceration necessitates partial cystectomy. Renal failure and the most dry complication, squamous cell carcinoma, require total cystectomy with urinary diversion. The prognosis: mild and early cases of schistosomiasis are not likely to result in the severe damage to the urinary tracts. The massive repeated infections undermine the function of the urinary tract to such an extent that the patients are disabled and becomes chronic and invalid. Those life spans are shortened by the 1 or 2 decades. That's briefly about the schistosomiasis.